Hello, viewer. Thank you for joining me once again on this real talk show. So today we are going to discuss maternal and newborn health, and in relation now to COVID-19. So the country that we're going to look at in this case is Kenya, and we are being joined by George and Evelyn. So let me welcome them so that they can even tell us where they are coming from and the organizations that they are representing. So Evelyn, kindly introduce yourself.
My name is Evelyn Boa. I come from Kenya, work in Kibera, and we do advocacies on matters to do with maternal and newborn health in the community, to advocate for women to attend clinics all the time and to have information on issues to do with maternal and newborn health.
Okay. So I'd like also to bring in George. George, kindly introduce yourself and what you do.
Hi guys, my name is George Mbiti. I work at Community Peace Network, and I also deal with the matters to do with maternal and newborn health.
All right. So I'd like to ask you, George, how has the curfew affected maternal and newborn health here in Nairobi, and also even throughout Kenya as a whole?
Yes, the curfew was announced abruptly without any prior information. It was more of a surprise. Majority of people did not expect it. Most of the people are looking towards a lockdown, but the way it came, it was abrupt. A lot of people were not expecting that it will have happened. As soon as it did, it caught a lot of people off guard. So it has affected MNH, or maternal and newborn health, in a lot of ways, since the government did not put any strategies to cater for mothers or expectant women during this period. So the curfew came in, and things like a toll-free number that perhaps an expectant mother could reach the nearest hospital or the nearest maternal hospital were not provided. It is an area that I think the government needs to improve, since a lot of things can go wrong, especially during this curfew. For instance, if a pregnant woman gets into labor during these hours, we are talking right now, it is 10 or 4 p.m. In Nairobi. If a mother, an expectant woman, gets into labor right now, it will be hard for that woman to get to hospital. One, security. How is the security catered for? Second, it will even be hard to get transport. We don't have border borders operating at night. We don't have taxis operating at night. They are not included as essential services. So it becomes very tricky getting this expectant woman to the nearest maternal hospital for her to deliver. So in short, what I'm trying to say is that we now have two lives in danger, not one, but two lives. So I feel it is an area that the government needs to improve.
All right, Evelyn, I'd
Yes.
like to ask you, what do you think about like the maternal and newborn health services at the moment? How have they been disrupted?
So I think for maternal and newborn health, when we look at the lives of pregnant mothers currently, they're not in a position to access hospitals at night, because even as George has mentioned, it is a challenge. Even they have fear, because some of them fear that they can be beaten and they can be exposed to terror beating because they are moving outside their curfew time. So I think it is not good. The government should do something on how mothers can access maternal care at night for them to avoid the cases of deliveries in the house.
Hey. All right, George, I'd like to ask you a question. Are mothers getting enough information about how to ensure that their babies are safe at this period?
Actually, my views on that is that not only about the kids, the newborns, actually, there's no information that I know of so far that the government is offering that is only designed to address mothers or expectant women. The thing is that the government is just checking out information that is general for everyone. There's no way that they have specialized some information that is only designed to address such issues as pregnant women. So I think the government should do more. Uh, Things like booklets, those are things that can be provided during hospital visits, maternal visits, clinical visits. These are things that should be readily available. There shouldn't be a need to ask for them at this juncture. This should have been readily available even before the disease, the coronavirus reached our country. I think the government needs to publish more leaflets, pamphlets, booklets, and distribute to at clinic level so that all mothers countrywide can access them.
So, George, I think we have an issue with the wireless internet, yeah?
Yes.
So, I don't know how we're gonna sort it
Uh,
out.
we can try and proceed as we wait for her to come back online.
Okay.
Yeah, so I don't know what kind of views you have on the same.
About issues to do with government provisions on maternal newborn, or
About
which area?
government providing enough or adequate information for mothers, expectant mothers, about the health of their children and also themselves.
Yeah, okay. For me, I think the government has not given information about maternal care right now, more so during the curfew, because we understand at 4 o'clock most hospitals are closed down. And so it's a challenge for a pregnant woman to access a hospital. And
True.
even the police are not made aware or know how they can treat pregnant women during this time. So I think information needs to be improved on, specifically for women and pregnant women, and how they can also protect themselves during this time, apart from washing their hands, keeping social distance. How can they protect the baby inside? So
Yeah,
I
so I
feel
think
the government needs to improve on that area.
I can see Violet is back online, so she can continue sharing the show.
Ah, oh, thank you once again. Um, so what came to your mind when you heard that a child who's 2 years old is infected with the COVID-19? What came to your mind, Evelyn?
For me, what came into my mind, as much as we are talking about it's affecting the elderly, it does not have it does not have like you say that it does not have age bracket where it will affect. It is open to anyone, and so everyone needs to be taken care of with the highest care currently. I don't know what about George.
So, in my view, I feel like the government so far it has been uh, reactive in matters to do with preventing the spread of this disease. Since, as we've seen, the disease did not start this month, neither did it start last month. The disease actually, the virus actually started
Okay.
in December.
Uh,
So I feel like the government
Maybe
should
George, you
have
can
taken,
elaborate further.
yeah, I feel like the government should have taken proactive steps early enough to make sure that the virus shouldn't have landed in Kenya. But now, since we have the disease, the virus in Kenya, I think the pace, which is also can be attributed to the limitation when it comes to the number of test kits we have. I'm thankful Cambry has decided to pick it up and it's starting to produce kits that are 98.9% accurate in the results. I think there should be need to quickly scale up the number of tests so that we know who's infected from who's not. Like in the case of, it was sad that we experienced a 2-year-old getting affected. Our neighbors in Uganda had a number of 11 kids. In fact, it was the only reported new cases in a day whereby we found 11 kids tested positive for coronavirus. This it was alarming. It is really alarming that the numbers that are being talked about for that particular day, all of them are kids. This shows that the playfulness or the grounds that kids play really poses a challenge when it comes to controlling the virus. So even the curfew, I have a feeling that it is not enough in curbing since we have kids who are playing outside the whole day. This is transmission from one kid to another. And if we look at social points, especially in the Kenyan culture, we find that they are almost similar across Africa. Uh, we don't have parents who are monitoring how kids are playing. No, we just have kids who are sent out to go play the whole day. Then they come back home at the evening, or perhaps some play even at night. So I think the government needs to do more in terms of controlling the spread.
Yeah, very true. Nafunga camera. So has
Okay.
this affected other
So,
countries?
Evelyn,
Yes.
yeah, so Evelyn, I'd like to ask you, are there strategies that are in place to assist expectant women and newborn mothers with regard now to COVID-19? Okay.
What has been in place? I think everything runs well from 5 p.m. from 5 a.m. till 7 p.m. Till 7 p.m. Yeah. But then after 7 p.m., that is now the problem comes in, because there's no appropriate information provided
Have you heard my
for
question?
people. So I think the strategies are not yet laid down, but I think something can be done.
George,
Yes.
maybe I can. Yes.
George, you can continue and add on.
You can. I think you can just finish your point first. Hello, Evelyn. You can finish the point.
Yes.
You can finish the point.
Okay. What's your take on that, George?
Can you rephrase kindly?
She was asking about
Yeah.
what strategies have been put in place.
I think she had finished.
Okay, kindly you can continue, Evelyn. What has she asked?
Strategies that have been in place.
In matters to do with MNH, right?
Yes, yes.
Yeah.
I
So
think
I was asking. I'd like to hear your views on strategies that are in place. Yeah.
actually, from my point of view, I think the government has not like broken down how each category of people should be treated in matters of, let's say, we're not only referring to maternal health or neonatal health, we're also referring to
Yeah.
people with
Yeah.
disability. We're also referring to people who have special needs. We are referring to the elderly. There's no clear, proper guideline that has been put out by the government that can say this is how an elderly person is supposed to be handled in matters during this pandemic period. So it is not an issue, a unique issue that is only affecting maternal health. It is also an issue that is affecting across board to do with all other special needs. And we can also treat the cases of pregnant women during this period as a special need, since they are looking after their health, and they are looking after the health of those who they are carrying, and also even those mothers who already have children. So the government needs to come up with a clear guideline that clearly demonstrates this is how a mother is supposed to, this is how an expectant woman is supposed to be treated in a hospital. And also, given that all the talk is now about COVID-19, nobody is also talking about, it's like the government has ignored all other needs. It's like all other diseases have disappeared. It is only COVID-19 that is the disease of the day. People with cancer are not being referred to. People with other ailments are not being referred to. So the government needs to do more, especially in regards to matters to do with maternal health, because if we have a population that is being affected right now, for instance, if we do not protect the young, we do not protect the expectant women, we will not have a future to look forward to in the coming days. Yes.
All right. So in Nairobi County, since both of you are based in Nairobi County, so how do you think the transfer of the health docket to the national government, do you think it's going to improve services, maternal newborn health services, or what's your take on it, George?
I think, or I hope that the change is for the better, since we've the evolution of health came with its own challenges. We saw more strikes that took place during that period, and the change of guard. I feel that it should be for the better, since we had less strikes when it came to when the docket was still under the national government. So I feel if the government is really serious, it will really improve the health docket, especially for the residents of Nairobi County. We have a booming population.
Have you
If
heard
you,
the question?
yes, I have. So as I'm saying, we've had the 2009 census and the 2019 census. We find that there's a 41% population increment, and we still have less facilities. We are still experiencing shortage of doctors, shortage of commodities at hospitals. I feel like right now that it has been reverted back to the national government is now at a place that it can improve services, especially for Nairobi residents. And I also wish it can be the same case with the other counties, uh, since it was devolved to other county at the county level. You find that each governor is negotiating with doctors at his own pace, which has really brought the docket down. And it is evident that mothers suffer a lot during this period, especially when there are strikes. Mothers are always the ones taking the brunt. They have to deliver at home. Some deliver on the way to hospital. Some deliver on the floors at hospital, since there are no nurses or doctors to cater for them. So I feel that it is really good that it has reverted back to the national government, and we as CSOs, we are going to continue advocating for better maternal and neonatal health. So I don't know, what are your views, Evelyn?
So for me, I think what you've mentioned is still it's okay, and we've seen yes, Mutai Kagwe working very well in terms of providing information towards the current situation, and so for me, I don't have any issues with it. It's very okay as long as things will move and actions will be taken acted on very easily to deter the issues of the procedures that are aligned towards the decision to be made by who. So for me, I think it is the best decision because currently this is a nationwide. It is a global pandemic, and so when it
Yeah.
affects a particular area, it affects everyone. So for me, I don't have any issues with it.
Ah, great, great, great. So, at this particular period of time, do you think the government should, the national government should allocate more resources towards maternal and newborn health?
Who's answering that?
Pardon?
Who's the question referred to?
You can go ahead and answer, George.
Yeah, okay. I feel we've been having an issue with the Nairobi. I'll speak for Nairobi County since I'm a resident of Nairobi County. We've been having a shortage of resources, not only in hospitals. We are talking holistically when it comes to budget allocation. It has always been a struggle. We have to advocate for the budget to be increased as we look at other counties that are doing better. They are matching up to the expectations of budget allocation. But in Nairobi County, it has been a struggle, given that we are the city which has a big population. So I feel that the budget should not, I won't say it should be increased. What I will say is the budget should be put to better use. We need to see the budget catering for commodities, especially during this pandemic. It is a pandemic that is affecting the whole world. But we have mothers. Mothers at this moment are more vulnerable than, I won't say more vulnerable, they are perhaps the second most vulnerable after the people of old age. They should be given attention. That is what I will say. And also, on the same note, I feel that it is important that we have nurses who are taking care of these mothers in hospitals to be well catered for. We are talking about equipment. They should have the PPE equipment with them. We are also talking about issues to do with ambulances. They are really critical, especially during this period. We need them. Mothers need them so that they can be delivered in hospitals on time. Having mothers deliver at home, it puts both lives at risk. So I feel that I won't advocate for more money to be allocated, but I would advocate that the government does not ignore maternal and neonatal health during these trying times.
All right. So I'd like to ask you, Evelyn, can you hear me?
Yes. Yes.
Yeah, so I'd like to ask you, are the clinics well equipped to cater for in Nairobi County? Are they well equipped to cater for expectant women and also newborn mothers, especially at this particular time of COVID-19?
I would say that we are currently challenged due to this pandemic, because number one, you get the hospitals are, some of them are filled up. So I think something needs to be done, because when the hospital is not fully equipped, women will not get equal services they're supposed to get, because you'll get a hospital has no e- like infrastructure for someone to be taken care of. So I think for me they are not fully equipped currently, and most of them are not, most hospitals are not doing surgeries.
Ah,
So it is also a main problem.
okay. So, George, what's your
Yes.
take on now the clinics being equipped? Do you think
Yeah.
they are well equipped?
At the moment, countrywide, you can see all hospitals are gearing up towards handling COVID-19 cases, which means that even the wards that were first allocated for maternal purposes will also be, at some point, will also be converted into centers that can accommodate COVID-19 patients. So the only solution we have, at my point of view, is having clinics on sub-county levels, sub-location levels, being equipped and readily available. We need theaters in those clinics so that we can reduce pressure on national and referral institutions. We need clinics to be equipped with theaters. We need clinics to be equipped with enough commodities such as medicine, gloves, masks, and all that is needed to make sure that a mother is delivers in safe hands. At the same time, we need blood. We've been having a shortage of blood in Kenya. We've been having cases whereby we have scandals that blood meant for Kenyan patients is being transferred to Somalia. These are issues that the government needs to look into with the seriousness so that we have enough blood, given that one of the causes that leads mothers to die during childbirth is uh, bleeding a lot. So if we do not have blood to help these mothers recover quick, then it means we are going to lose more mothers, especially during this pandemic. So the government needs to equip these clinics with enough staff and enough commodities and also enough infrastructure so that we are able to reduce the pressure that normally goes towards the upper institutions Mama Ngina, Mama Lucy Hospital, Kenyatta Hospital, Mbagathi Hospital, and also Pumwani Hospital.
All right, all right. So I'd like to ask you, like, What are you currently doing as CSOs in Nairobi County to curb the COVID-19 pandemic, especially with regard to maternal newborn health? We can start maybe with Evelyn. What are you guys doing at the moment? You may share.
Also, what we have decided we are going to do, we have decided, since we are conducting door-to-door advocacies, so we are encouraging women to continue with their clinic attendance. That is number one. And then number two, we are advocating for them to be able to access hospital anytime they feel like they are due, the delivery is due. They should not fear. They should have emergency contact for them to access hospital, not to stay at home. And then we are also telling women to currently to be alert with this, because you never know at what will you start having pregnancy pains. So I think we are doing our level best. So we have reached so many people, and they're also doing sensitization on a local hospital with women who are attending their clinics. We are continuing to do their sensitization on their role towards this pandemic as mothers, and how they can take care of their kids. So that is what we are doing currently.
All right. So I'd also like to ask George. George, what is your organization currently doing to curb this COVID-19 pandemic here in Nairobi County?
Actually, at the moment, we do understand that COVID-19 is now the new talk in town, and what we are doing currently as CSOs on the ground, we are trying to sensitize expectant women on how to stay safe at grassroots level to try and avoid contracting the virus, which puts them at a higher chance of succumbing to it. We are trying also to try and teach them how to keep their children safe, and also babies, and also even the ones they are carrying in the womb. Since if the mother contracts the virus, it means also the child is at a danger of contracting the virus. We've seen cases where newborns around the world are being born having the disease. We also have a similar case here in Kenya, which happened that a mother who was expectant gave birth to a kid, although we are not yet sure to know if the kid is positive or not. So we are trying our level best, given also we are operating on limited resources. We're trying our level best to make sure that mothers are well informed. That is the best we can do on our end as a CSOs on the ground.
Okay, nice. So there are some questions that I'd like you maybe to answer again, because the internet was a bit down earlier on. So I'd like to ask you, how has the curfew affected maternal newborn health?
The curfew has affected maternal newborn health in matters that it has limited movement, not only for mothers but everyone. But we have to give emphasis on mothers because they are carrying, especially expectant mothers are carrying another life within them. So it has affected them in a very big way, since in case of danger, it becomes hard for them to get to the nearest clinic or also the nearest hospital.
So what came to your mind when you heard that the woman in Kibwezi died, bled to death as a result of the curfew? What came to mind?
The first thing that clicked in my mind was the unpreparedness of the government. They were not ready. They hadn't put in place, or they did not have a plan ready on how to address expectant women during this period. It showed the loopholes that are in the plan, the overall plan of the government. It showed that there was no prioritization of these matters in the planning stages. These are issues that should have been planned prior. A contingency plan should have been put in place months. Not We are not talking of this month of April. We are talking of something of February. The minute the news started breaking that the virus was now crossing borders from China, this is the time the government should have taken to make sure that there are enough plans to take care of every group. Not only We are not only talking about pregnant women or MNH. We are talking about all sectors. These plans should have been made prior.
Okay. So, Evelyn, I'd like you to add more into what George has said. Uh, when you heard of the child who died, of the pregnant woman who died while going to hospital, and this she bled to death as a result of the curfew. So, how did you feel when you heard this particular news?
I felt so bad. It was heartbreaking because the government is in a position to rescue lives currently. And so when such a thing can happen at this world right now, it is very heartbreaking. And so I think as much as we are saying the government is not playing the role, but I think we can stand up and inform our pregnant women that they can still access hospital and also avoid fear. People are fearing so much because of this pandemic. So for me, I'd encourage people to stop fearing because it does not add up anything. It brings a lot of more problems. Yeah.
Okay. So, have both of you managed to visit now the nearest health centers to see where to maybe to so that maybe you can hear maybe whether there are people who have been pregnant women who have been infected with COVID-19, or have you managed to visit the nearest health center, or you're just at home?
So as currently we are working very closely with a health center called Kibera South in Kibra. So what we are doing, we are trying to sensitize people towards corona. And so we have not received any information of a pregnant woman who has been infected with COVID-19. So we are not at home. We are working very hard to ensure these women have information.
Okay. So, at the moment, you are finding that like politicians are quiet on the issue. They are not vocal or even raising awareness about this issue. So, what is your message, Evelyn, now to the political leaders?
For me, I think my message to the political leaders is they need to rise when the need has come, because we have a need and they've not rised up to their duties. So for me is to tell them to rise and speak up and do something about these things, because number one, we can't suffer and we have leaders on board who can come up and assist in making decisions. We should not leave everything to particular area, to a particular department. We need to work as a team because every area has different situations. And so for me, I'd advise the political leaders to come in and work as a team and learn from other people who are doing great things outside there to support their counties in doing what they are supposed to do and supporting young mothers. So for me, I'd call upon the political leaders to rise. They are sleeping so much. We need to hear them. We need to feel them. We have the women rep. We have different people who can rise up upon this occasion to support the maternal case in Kenya. Yes.
All right. So, George, I'd also like to ask you, what message do you have for political leaders, especially you see like MPs, like even maybe your MP is quiet on the issue. So, what message do you have for him, and also for the other political leaders across the country with regard now to paying attention to maternal and newborn health?
First of all, I'm surprised that our political leaders have decided to go quiet. And yet, if it was the other way around, if we were in a campaign period, they will be all over distributing free T-shirts. I would like to thank the few that have decided to sacrifice their salaries towards trying to handle this pandemic. On the other hand, I would also like to tell the quiet leaders that past this period, let's consider this a phase, but issues
Yeah.
to do with material health, these are issues that are always going to be there with us. They shouldn't be quiet, especially they should be representing the people for what the people chose them to do, which is representation. They should be advocating for these people on the grassroots level to get enough rationing of food. Especially, we are looking at mothers. We have single mothers all over the country who cannot go outside to work because of the curfews and also limitation of movement. These people are vulnerable. They are vulnerable to diseases. They are vulnerable to hunger and starvation. We need these leaders to wake up and speak about issues affecting the people on the ground. We need them to address the budget allocation when it comes to maternal and neonatal health. We need them to make sure they need to be the oversight committees over how the money is being spent, what is being done, what is lacking at the institutions, where can things be improved. But at the moment, what we're experiencing, we have like 98% of our leaders quiet, which raises a lot of questions. Uh, how come it's like health is a secondary issue? And even past this pandemic, we need the government along with the elected leaders to take health seriously, not only maternal health, but having COVID-19 outbreak has exposed a lot of things. It has exposed a lot of loopholes in our health system. We need improvement in those sectors. And I also would like to say that these leaders also have to see corruption, which eats away the gains that we've made in the health sector, and it eats away the future of our children. They need to address it. It is no longer business as usual. Starting from now henceforth, they need to be serious. We need to see real changes that are happening. We need to see budget allocation, reasonable budget allocation to health sector.
Okay. So in 2001, during the Abuja Declaration, Kenya committed and pledged that they are going to allocate 15% of their national budget, 15% of it towards health. So at the moment, it is at 7%. So what message do you have now with regard to implementation? What do you think is the reason behind the government not implementing the 15% allocation? Maybe Evelyn, you can towards health. Evelyn, maybe you can go ahead and answer that.
So one thing that I think the government during this period of budgeting, we also need to factor in what are some of the key things that we need to factor in our budget. Because when we come objective in our mind and know what we are working towards achieving, it will assist us to reach towards the 15%. You see, the 7% is not even half. It's half of the 15%. But then you see, we are not yet there. We need to prioritize what are we bringing first on board to assist in this pandemic period, to assist in the maybe life after this pandemic period. What can we do? What can we do better? Because I believe this is a learning process for us as Kenyans that will open our eyes more wider to see on what we can change and what we can be thinking about. You see, if we talked about the ICU beds, are they accessible in all the counties? What can we do to have all beds in all the counties? So I think it's a matter of prioritization and seeing what will work best for every Kenyan. Yes.
All right. So you mentioned it's a matter of prioritization. So I'd like to ask you, George, um, have you maybe submitted memos to the to now the county government of Nairobi through the various sub-county uh, forums? Have you submitted memos for them now to increase the health budget, especially with regard to maternal and newborn health and also family planning?
Yes, we have participated in several public participation forums organized by the county government, and we have done our best, our level best, to make sure that we are heard as CSOs on the ground. We've done our level best to submit memos that indicate our interest to see the budget allocation increased, because budget, when it comes to health, health is a serious issue. It is a backbone of the nation. If we do not have a healthy population, it means you will not have a workforce that will drive the economy forward. So we need, this is an area that needs increment, and it is very sad to see that Nairobi County lags behind many other counties when it comes to budget allocation. It has been a struggle to see that this budget is increased on a reasonable basis on an annual, every annual budget allocation. It has been a real struggle, and it is a struggle that we as CSOs on the ground, together with the willing leaders, have been trying to influence the county government and the county assembly to make sure that the budget does not stall. It needs to grow as the population grows. We need more institutions, we need more hospitals on the ground. Uh, we need hospitals that can match up to the boom, the population boom that is currently happening. And we've also tried voicing our voices online. We've done campaigns online to see, to try and reach out to leaders who are in positions of influence and position of decision making as well.
Oh, all right. So, I'd like to share that last year we submitted a memo to now the Nairobi County through the Starehe sub county, and also participated even during the Charter Hall validation meeting. And last year we had campaigned for an increase of the maternal and newborn health, or maybe we can put it as RAMCA, reproductive maternal newborn health, adolescent health, so that they can increase the health budget there. And they increased it by $5 million for the financial year 2019-2020. All right, of which we are grateful, for. And we thank even the county government led by Governor Sonko for hearing also our pleas. So I just wanted to ask, with regard now to the financial year 2020-21, Evelyn, has your organization maybe participated in the public participation forum and maybe asked for an increase of the health budget, especially with regard to maternal and newborn health in Nairobi?
Yes, we have participated in the process for the public participation. We have attended the ward level community participation in our community here in Kibra. And then we've also been in a position to go through the process of validating the budget 2019-2020, but then you see it didn't work out well because there were a lot of gaps in the process. So we agreed that they will come back and give us something better for us to argue on. So as an organization, we have been in this process. We presented memos, and we will still be in to ensure that things work best.
All right. So, like this week, we commemorated World Health Day on 7th April, and today we commemorated Maternal Health Day. So, and we held social media campaigns with regard to ensuring that we are sending messages to now decision makers. And one thing I can say is that this week, I saw it published on the People Daily that now attention has been raised by CSOs through their advocacy, and the national government, especially the Ministry of Health, has now also focused its attention on maternal and newborn health. So when you heard this news in the newspaper, George, what came to your mind?
At first, I was taken surprise, and at the same time, I was happy because I saw that advocacy really works. Advocacy reaches the people who are in a position of power. Advocacy reaches people who are the key decision makers. And I also felt like using online as a tool of advocacy is a very important tool. It is effective. It makes sure that resources that have been allocated for advocacy are well utilized. And the result is that the government took notice, and it started implementing MNH. It involved MNH in its plans in combating COVID-19. That is really key. It is an achievement for CSOs that participated. It is an achievement that all CSOs, in fact, should be proud of.
All right. So, like Evelyn, when you saw that
Yes.
the national government has started listening to our concerns, because this week we had campaigned that that focus should also be on pregnant and newborn mothers, especially with regard to COVID-19. And we saw like the newspapers also caught up with our advocacy. So when you saw the headline in the newspaper, what came to your mind?
As for me, I think that was a good work for us, and to the team, that is good work, because number one, currently we are working at home, and we can also do something while still working at home during this pandemic. So one thing, I felt so good, and I felt like our voices have been heard, and our advocacy for the maternal and newborn health is going to a next step. So it is just the beginning, and will ensure that through this process, women will have an opportunity to access these services despite the challenges that we have currently. And the key decision makers and influencers will join in the process to ensure that this thing is done and the dream is achieved. Yes.
All right, okay. So the other thing I'd also like to ask to state is that we've heard that there is this drug called chlorophyll. All right. So do you think that people should just go to the chemist and purchase the chlorophyll, or they should desist from it, because they're saying that if you purchase chlorophyll, it's going to maybe help you heal faster from COVID-19. So I'm asking this on behalf maybe of the pregnant mothers, and also mothers who have just given birth. Do you think it's advisable for them to take the chlorophyll, the hydrochlorophyll? George, maybe you
I
can go ahead
do.
and answer.
Okay. Yes, there have been talk that chloroquine is used in curing COVID-19, but as I've been seeing online from other media outlets, it is not used on its own. It is used with a combination of other drugs, and this is something that experts have to deliberate on. It is not something that, since it's been said, it is not something that everyone should pick up and go implement at their own homes. So far, the government has not given any directive for the medicine to be used as a treatment for COVID-19. And even in the US, yes, the President Trump has been saying it is a cure, but it is still assessed by the FDA to determine if it is true. This is a field I believe only experts in the matters of medicine can address. And once they give a green light that it is a cure, then it can be used. But at the moment, having people buy the medicine over the counter puts their lives at risk, given that the medicine is really strong, especially when it is used for malaria. So I can also imagine it being misused at the hands of local people or people on the ground without any prescription from the doctors, without knowing what dosage is used or what other combination of drugs that can be used alongside chloroquine. So I think it is best that the Kenyan population waits for directive from the government so that we know which medicine can be used. But at the moment, as I understand, it is being used in combination with other drugs.
All right. So Evelyn, I'd also like you to add with regard now to the use of hydrochlorophyll by pregnant mothers and newborn mothers, and yet it's not a doctor who has prescribed. So what's your message to them? Should they use or
I don't.
should they?
Now, for me, I always advise not to use a medicine before it is medically prescribed by a doctor. Because, number one, remember, we have different reactions to some drugs and it can affect someone's health. So, for me, I would advise the mothers not to buy a drug from over the counter in the chemist. But what they need to do, they need to get prescriptions from hospitals.
All right. So lastly, I'd like you maybe to send a message to now the political leaders, or not, let us now be specific. I'd like you to maybe send a message to the Cabinet Secretary for Health, CS Kagwe. If you are seated at the table with him, in the presence of even the Nairobi County Governor, what will you tell them with regard to maternal and newborn health services? So we'll start with you, George.
My message to the CS is that the MNH field has been downplayed or downsized because of the current pandemic that is at hand. I feel that a lot of attention should be given to that sector. Hospitals should not start neglecting maternal and neonatal health. We had a case at Mama Lucy Hospital where a woman got turned back only for her to die in her house all alone trying to give birth because she overbled. That is a serious issue. It shows the magnitude of the problem. The government should continue treating maternal and neonatal health with the same attention and the same energy that they used to give it before the COVID-19. It is a maternal and neonatal is a sector that will still be there, but with things to do with COVID, it is a passing phase whereby a cure might be found and lives will go back to normal. So I don't see the need to start ignoring it today. We cannot have mothers dying at their houses because they cannot access hospitals on time, or they are being turned away, or there are no ambulance services. In fact, we should be having a toll-free number whereby mothers can access ambulance services during curfew. Since right now we don't have that in place, we also need the ambulance services to be free of charge. Since these mothers are no longer working, they are seated at home. And also, if it is possible, all fees to do with the maternal issues and neonatal issues during this COVID-19 should be waived so that more mothers show up at hospitals seeking medical services.
All right. So I'd like also now to bring in Evelyn. So Evelyn, like if you are seated now at the office of the CS for Health, in the presence also of the Nairobi County Governor, what message would you have for them with regard now to paying attention to maternal and newborn health
So for me, number one is they need to go back to the drawing board and get to know what were the priorities that they had set for them to ensure that we be in a position where we're supposed to be when we are taking care of the pregnant women and the newborn babies. So number one is they need to ensure that availability of resources is fully available. Number two, they need to ensure that easy access to information all the time. And then number three, to partner with people, like-minded people, to help them in the implementation of the maternal and neonatal care. So then the last thing that I'll share with them is everything they're doing is important, but then they also need to hear the voices of those pregnant women. What will they desire for them to be done? Let them hear voices from these women so that they also feel what these women really, really want. So for me, that is what I would let them know. And then maybe they would have a priority for women in all the things that they're doing. What if this happen? What will happen to these pregnant women? How will they let them have them back at their mind in all the decisions that they're making? Yeah.
All right. All right. So I'd like to thank the two of you for joining us today. Unless there's something that you'd like to add, is there anything that you'd like to add?
Yeah,
I'd like to tell the community, number one, to support the government in all that they're doing, and also they also have a role to play in ensuring that these all these things are achieved. So together we can make it.
All right. Okay. And what about you, George?
on my
What would you like to add?
On my end, I just want to urge everyone to stay safe. The government has told us that if it is not a need for you to be outside, please stay at home. This is something very serious. We've noticed that majority of people keep downplaying the warnings from the government. This is a pandemic. It has affected the whole world. We should follow all the guidelines that are being provided by the government. We are told to wash our hands, keep distance, social distance. We are told to stay at home, and these are crucial moments that we need to do what the government is telling us if we really want to contain this problem. It doesn't have to reach us for us to know that it is truly a pandemic. We need to be serious with it, and we need to act upon it.
All right. So I want to say thank you to both of you for joining us for this session, and also for sharing your input with regard to maternal newborn health. So viewers, we decided to conduct the session today because today was Maternal Health Day. So it is something that it is an event that is celebrated all over the world. And also on 7th April, we celebrated the World Health Day. So thank you for joining us. Sorry that in the beginning there was an issue with the network connection, but we overcame it later on, and we had now a smooth now interview. So thank you for joining us. So asanteni sana, and see you next week. And I will not next week, but see you in the near future once this curfew is over and once we've dealt with the COVID-19. So I wish you all a productive week, and pass even my love to your loved ones as well. Thank you.
Thank you so much, Violet. It was nice.
All right. Thank you, George, as well.
Thank you as well.
Okay, so thank you, viewer, for joining us. So we are going to host another guest very soon, and we've reached out also to decision makers also to come and also share their views with regards now to the COVID-19. So join us soon, even as we discuss. Thank you. And if you've not yet subscribed, kindly do so that you can be getting notifications anytime we are going live. Thank you.